Hey Gary, Dr. Gettleman, King Star here in your left knee arthroscopy. I've inserted the arthroscope into your knee. What we're looking at here is the tip of my probe coming through this blue cannula, and the tip of that is 3 millimeters in size. It gives you some idea of the magnification of the system that we're looking at. Each one of those little laser etched lines that you see on the probe is 1 millimeter apart. It gives you some idea of the mag. What we're looking at here is the hole in the blue cannula. That hole is 1/8 of an inch or 3 millimeters. Again, you can get a sense of the magnification. It's at least 25 times normal power. As I start by looking up here in the suprapatellar pouch, you see normal lining tissues up in here. That's all the way at the top of the pouch. You can see the expansion of your quadriceps mechanism there looks just fine. As I start to back up, what we'll see here is the undersurface of your kneecap, your patella, sitting right in here. Now what I want to do here is get a good look at your patella right over in this area. And what we'll see here is the undersurface of your kneecap looks nice and smooth, no signs of any fraying or tearing. So this is the apex of your patella. This is the lateral patellar facet over on this side, and then we see the medial patellar facet over on this side. And your kneecap actually looks to be well preserved, no signs of any advanced wear change. As I let the knee bend just a little bit, you can see the groove now that the kneecap glides within. And we can see just a little bit of chondral fissuring right in there. That's just a little bit of early degenerative joint disease starting to happen here. Here's the lateral patella facet, and that actually looks pretty good. The medial facet over there looks pretty good as well. As we follow this down to the tibiofemoral joint right in here, what we can see here is the weight-bearing area, your lateral femoral condyle. And what you can see is this portion of your lateral femoral condyle looks to be well preserved. Here's the anterior horny or lateral meniscus, which looks to be intact. Here's your anterior cruciate ligament, which looks pretty good. We'll come past Hoffa's pad right in here, over to the inner side of your knee, and I'll get just a little bit of flow going here. And what you can see here is the weight-bearing area of the medial femoral condyle, a little bit of wear change there. And then we'll come over to what we call the medial gutter up the inner side of your knee. And I want to just take a good look at that. I don't see any signs of any loose chips or pieces over here in your medial gutter. That looks normal up there. As we come across the top of the suprapatellar pouch, this looks just fine. We'll come over here to the top of the lateral gutter, and I'll follow down the lateral gutter here, all the way down to the level of the lateral joint line right in here. And what we're looking at right here is your popliteus tendon right there. Popliteus looks okay, and here's the loose fragment sitting right next to the popliteus, and that's a favorite spot for that loose fragment to go. And so you can see it sitting right in there alongside the popliteus. So here's the popliteus tendon going from about 11 o'clock to about 5 o'clock, and then sitting right next to that is the full thickness chondral lesion. There's your loose body sitting right there, and that's what's getting stuck within the joint. We'll let it sit there for a moment because we know where it is. We'll look at the anterior horny or lateral meniscus there. That looks okay. We're going to go ahead and change the position of your leg here now for a second. And what I want to do here is take a good look here into the outer half of the joint. This is the lateral compartment. And what I'll do is I'll reposition this blue cannula here for a second so I can see what's going on here on the outer side of the joint. And what you'll see here, my blue cannula coming over, just a little bit more flow going, and we'll get that to clear. And what we'll see right in here is this lateral side, and what I need to do is get that well visualized.